Welcome to Pathways Magazine. This program is designed to give you a whole bunch of tools to help you empower your life to go one step beyond where you are right now. In this episode, we're going to be having a look at Tibetan massage to see how you can relax those weary muscles. Also, a look at Kahuna, which is the ancient Hawaiian religion. But right now, we're going to have a look at holistic dentistry.
I'm here to talk about homeopathic dentistry with Dr. Varley. Dr. Varley, thanks for joining us.
Thank you.
Now tell us, what is homeopathic dentistry?
Homeopathic dentistry is a complementary approach to conventional dentistry, where we use homeopathic remedies instead of orthodox drugs.
Okay, so how is it different to traditional dentistry?
Well, it's probably best if I describe a patient I had recently who came in with an abscess, and she had been to the dentist about 2 weeks ago, or 2 weeks before, and I asked her what went wrong, and she said the dentist wanted to take an x-ray. He wanted to give her a local anaesthetic, which she said she's allergic to. He wanted to put her on antibiotics and wanted to put a mercury filling in her tooth. So all these 4 areas of radiation, adrenaline and local anaesthetics, because I haven't met a patient yet who's been actually allergic to it, but it's a strange feeling adrenaline gives. The mercury and the antibiotics, so these are 4 areas that are either toxic or stressful to the patient. And we try and avoid those areas of toxicity and to reduce the stressful part of it. So I'll use a non-adrenaline local anaesthetic. I'll use digital x-rays and use a homeopathic x-ray remedy while I'm using it, also a lead apron. We use non-mercury fillings, the white composite resin, and there are many homeopathic remedies to replace antibiotics. Having said that, I will prescribe antibiotics when necessary, but my prescriptions are probably 80% less, so 20% of what I was prescribing before I was involved in homeopathy.
Okay. Dr. Varley, what advice do you have for people to keep their teeth and gums healthy?
For the teeth, it's primarily diet. Avoid sugary substances on a frequent basis. And for the gums, it's primarily brushing and flossing daily. And I think what you do at home is a lot more important than what you do at the surgery. There are many homeopathic remedies for bleeding or sore gums, and I tend to avoid these because by good approach to flossing and good approach to brushing, no medicine is necessary, whether it's orthodox or homeopathic. And people can sometimes rely on that little white pill when it can be proven it's just physical removal of the plaque.
How important is nutrition in the role of dental care?
At one level, nutrition is very important, but not in the way most people think. It's not a general nutrition thing like Captain Cook and his scurvy. It's more just to do with sucrose. Tooth decay is directly related to the frequency of eating or drinking sucrose, which is common sugar. There's no relationship between brushing your teeth and tooth decay. It's a number of repetitive, short, sharp sucrose attacks. The bacteria eat the sucrose, produce acid, and leaches calcium out of your teeth. Brushing your teeth at night time is not going to put that calcium back again. So the only way to reduce tooth decay is by reducing the frequency of sucrose.
There's been a trend in recent times to remove amalgam fillings. Why is that?
I think the general population is becoming disillusioned with conventional medicine. There's a lot of chronic illnesses like chronic fatigue and multiple sclerosis, these type of illnesses, that people are looking for alternative ways because conventional medicine isn't supporting them sufficiently. Mercury is a toxic substance that obviously comes up in the people seeking ways of making their body healthier. It's in the press a lot, it's on the internet, and there's a lot of naturopaths, natural therapists are looking at mercury, and we get a number of patients coming through naturopaths who are recommending their mercury fillings replaced after testing them for various illnesses.
Okay, so what kind of effect does mercury have on the body?
Mercury works intracellularly on the enzyme systems within the cell, so it's like a low-grade chronic poison, blocking enzyme reactions, blocking the function of the cell. It's just a general effect. It does have a more specific effect on the nerve part of the body. It is prone to be is attracted to fatty tissues, and the lipid substances that surround nerves attracts mercury, and so you get a lot of neurotoxicity where you have some tingliness, weakness of the limbs, numbness, and these sort of symptoms.
Okay. What kind of process do you have to follow to remove mercury fillings?
It's very important what you do to having mercury removed. The time when most mercury gets into the body is when the amalgam filling's put in, and when it's removed if it's not removed properly. The primary thing we use is called a rubber dam. It's like a sheet of latex rubber that fits across the face, and the tooth is poked through the rubber, a small hole in the rubber, and so it's isolated from the back of the mouth. And so when the mercury's being drilled out, it's being sucked out with high-speed suction. We use a nose piece with oxygen to cover the nose so it's not being inhaled. The inhalation of the mercury is more of a worry than the ingestion of the mercury. So mercury absorption through the lungs is more efficient than mercury absorption through the stomach. But however, we still use charcoal tablets as well in case there's any tearing or leakage of the rubber dam. And the charcoal tablets binds to mercury, and the charcoal's not absorbed by the body but passes through. And we use homeopathic amalgam drops. So we use the mercury amalgam filling made into a homeopathic remedy to prepare the body for those people, primarily those people who are very ill or very sensitive to mercury.
And what do you replace the mercury with?
The commonest substance is called composite resin. It's the common white plastic filling. It's a composite of plastic and glass. That's equivalent in strength and style as an amalgam filling, mercury amalgam filling, but in a non-mercury material. There's no toxicity in the composite resin. For larger, more complicated fillings, you can also use porcelain or gold.
I had 4 amalgam fillings replaced about 2.5 years ago, and I'd been a little bit concerned with the idea of having mercury in my mouth, and so I suppose I felt it was just peace of mind to have it replaced, and it was, I suppose, one of the health benefits I've noticed. It's quite subtle, if anything, is my skin, but again, peace of mind.
I'd like to thank Dr. Peter Varley for talking to us about homeopathic dentistry today. So thank you, Dr. Varley.
Thank you, it's a pleasure.
For more information about the guests that appear on Pathways magazine, you can visit our website, which is www.pathways33.com. Now, after the break, I'm going to speak to Serge Kahili King, who is a Kahuna philosopher. So stay tuned and we'll continue straight after the break.